Rabbits are masters of disguise when it comes to pain and illness. In the wild, showing weakness makes them targets for predators, so they've evolved to hide their suffering extraordinarily well. This survival instinct continues in our homes, which means by the time your rabbit shows obvious signs of distress, they may have been suffering for quite some time. Today, we're going to explore the subtle, silent signs that your rabbit needs help, signs that are easy to miss if you don't know what to look for. Let's start with something that seems innocent: a quiet rabbit. Many owners assume their rabbit is just calm or well-behaved when they stop making noise, but rabbits are naturally active, curious animals. If your normally playful bunny is sitting still for extended periods, barely moving from one spot, this is a red flag. They might be pressing their belly against the floor or sitting hunched in a corner. This posture, often called hunching, indicates discomfort, particularly abdominal pain. Their eyes might be partially closed, or they might have a glazed, distant look. These rabbits aren't peaceful, they're suffering in silence. Another critical sign is changes in eating behavior, but not necessarily a complete loss of appetite. Watch how your rabbit eats. Are they approaching food with enthusiasm, but then walking away after a nibble or two? Are they eating their pellets but ignoring hay? Rabbits need to eat constantly to keep their digestive system moving. If they're being selective, eating less hay, or taking longer to finish meals, something is wrong. Their digestive system is incredibly delicate, and even a few hours without food can lead to a life-threatening condition called GI stasis. But here's the tricky part. Your rabbit might still be eating a little, making you think everything is fine when it's not. Look closely at their droppings. Yes, it sounds unpleasant, but your rabbit's fecal pellets tell an important story. Healthy droppings are round, uniform in size, and relatively dry. If you notice droppings that are smaller than usual, strung together like a pearl necklace, irregularly shaped, or if there are fewer droppings in the litter box, your rabbit is telling you they're unwell. Some owners only notice this change when they're cleaning the enclosure and realize there's much less waste than normal. By that point, the rabbit may have been struggling for a day or more. Breathing is another area where subtle changes speak volumes. You shouldn't hear your rabbit breathe under normal circumstances. If you can hear wheezing, clicking, or crackling sounds, or if you notice their sides heaving with effort, they're in respiratory distress. But even before it gets that obvious, watch for rapid, shallow breathing or flared nostrils. A rabbit's normal breathing rate is around 30 to 60 breaths per minute. Anything consistently above that range, especially when they're at rest, suggests pain, stress, or respiratory illness. Place your hand near their nose without touching them. You shouldn't feel strong puffs of air or hear any sound at all. Grinding teeth is something many people know about, but there are actually two types of tooth grinding in rabbits, and they mean very different things. Content tooth purring is soft, almost like a cat's purr, and happens during petting or relaxation. But loud, harsh tooth grinding is a pain response. If your rabbit is grinding their teeth loudly, especially when they're not being touched or when they're sitting alone, they're hurting. It might be dental pain, abdominal discomfort, or pain from another source, but it's their way of coping with suffering. Temperature regulation problems often go unnoticed. Rabbits can't sweat, and they're highly sensitive to temperature extremes. If your rabbit's ears feel unusually hot or cold to the touch, this can indicate fever or poor circulation. Cold ears, especially combined with lethargy, might mean they're going into shock. Very hot ears could signal fever or overheating. A healthy rabbit's ears should feel slightly warm, about the same temperature as your own skin. Run your hand gently along their ears during your daily interaction, and you'll quickly learn what's normal for your rabbit. Pay attention to their interaction with you. Rabbits are creatures of habit and routine. If your rabbit suddenly doesn't come to greet you when you approach their space, if they're not interested in their favorite treats, or if they flinch or move away when you reach to pet areas they normally enjoy, something has changed. Behavioral withdrawal is often one of the earliest signs of illness or injury. They're not being aloof or moody. They're conserving energy and protecting themselves because they don't feel well. Eye changes can be incredibly subtle. You might notice your rabbit's eyes look slightly sunken into their head, or perhaps one eye looks different from the other. Sunken eyes can indicate dehydration, a serious condition in rabbits. Or you might see a slight cloudiness or discharge that's easy to dismiss as, just a little tear. Any eye discharge, whether it's clear or colored, crusty or wet, should be evaluated. Rabbits don't cry emotional tears, so moisture around the eyes always means something medical is happening. Weight loss often happens gradually, and because rabbits are furry, it's easy to miss. Make it a habit to gently feel along your rabbit's spine and hips. You should feel a light layer of padding over the bones. If you can distinctly feel each vertebra, or if the hip bones are prominent and sharp, your rabbit has lost too much weight. This might be happening even if they appear to be eating normally, which could indicate dental problems preventing them from chewing properly, parasites, or an underlying illness. The position of their ears tells a story too. A rabbit in pain often holds their ears differently than usual. They might flatten them back against their head not out of fear, but because they lack the energy to hold them in their normal, alert position. Or one ear might droop while the other stays up, which could indicate an ear infection or neurological issue. Get to know your rabbit's normal ear position and movements so you can spot when something changes. Unusual stillness during times when they'd normally be active is concerning. Rabbits are crepuscular, meaning they're most active during dawn and dusk. If your rabbit isn't doing their usual evening binkies, running, or exploring during these peak activity times, take note. A rabbit that just sits and stares, or who doesn't react to interesting sounds, or the rustle of a treat bag, is not relaxed. They're likely dealing with pain or illness that's sapping their energy and interest in life. Some rabbits will isolate themselves when they're unwell. If you have a bonded pair and one suddenly separates from their partner, choosing to sit alone rather than cuddle, this is significant. Rabbits are social animals, and voluntary isolation is abnormal. Similarly, if your rabbit stops grooming themselves or their partner, you'll notice their fur looking a bit unkempt or matted. A healthy rabbit is fastidious about grooming. So what should you do if you notice any of these silent signs? First, understand that rabbits decline quickly. What seems like a small concern in the morning can become an emergency by evening. Don't wait to see if things improve. Contact a rabbit-savvy veterinarian as soon as possible. Not all vets are experienced with rabbits, so it's worth finding an exotic animal specialist before you need one. Keep their number readily available. While waiting for your vet appointment, keep your rabbit warm, quiet, and comfortable. Offer their favorite fresh herbs or greens to encourage eating. You can try hand-feeding small amounts of their pellets or offering water from a syringe if they're not drinking, but never force-feed without veterinary guidance. Keep monitoring their behavior and droppings, and note any changes to report to your vet. The most important thing is to trust your instincts. You know your rabbit better than anyone. If something feels off, even if you can't pinpoint exactly what it is, that intuition is valuable. Rabbits have survived as a species by hiding illness, which makes your careful observation their best defense in captivity. Check on your rabbit multiple times throughout the day. Notice their patterns and quirks. That baseline knowledge is what will help you catch the silent signs before suffering becomes a crisis. Your rabbit is counting on you to be their voice, to notice what they're trying so hard to hide. By learning these subtle signals, you can give your companion the help they need before it's too late.